focusing on a subject that affects thousands, millions of families all around the world: infertility and fertility treatments. To answer your important questions, we invited here today the Chief Embryologist of Asiri Hospitals, Miss Himashi Hapangama. Welcome to the program today. Hi.
Hello, thank you.
Yeah, so please tell us, what is the role of an embryologist in an IVF cycle?
Okay, let me start by saying when we talk about IVF, the layman's term is a test tube baby, right? So, an embryologist is the person who creates this test tube baby. So, if I go into details and explain, from the time we take out the eggs from the female partner and we take out the sperms from the male partner. So, embryologist is the person who fertilizes these eggs and creates the embryo, which becomes a baby, of course. And then we go on to freezing the embryo, and then sometimes after freezing we bring it back to body temperature and we transit back to the womb of the mother. So this whole process is done by the embryologist. So when you take an IVF cycle, 50% is done by the subfertility specialist. The next 50% or the other 50% is done by the embryologist. I hope that's clear.
Yeah. So, what factors contributing the creation of a healthy embryo?
There are few factors. Of course, when you look at it, the start would be the gametes. Gametes means the eggs and the sperms. All right. So most of the time the patients come to us because there is an issue with the egg quality or the sperm quality, right? So first of all, we need to get good quality eggs and sperm, right? So for that we have to give injections, medications. The dosage of these medications are important. So all this is done by the subfertility specialist. So the skill, the knowledge, all this is important to get good eggs and good sperms. I'm going in layman's terms. And then, of course, like I said before, we take out the eggs. Then comes the embryologist, right? We have to make the baby. So the skills of the embryologist, the experience and the knowledge of the embryologist plays a huge role, making sure that there are healthy embryos, right? And then this baby is made in a laboratory. So the conditions of the laboratory is extremely important. So when we look at Asiri Fertility Center, our laboratories are accredited by ACHS, which is an Australian accreditation. And personally, I'm certified by the American Reproductive Medicine Society. So I follow all those guidelines. So sticking on to the guidelines is important, and then making sure that all the incubators, that which becomes the womb in a laboratory, the incubator conditions are important, the air quality of the laboratory is important. So if someone is looking into getting healthy embryos, they have to look into the subfertility specialist, they have to look into the embryologist, and then of course the laboratories. So all these are key components of ensuring a healthy embryo development.
It sounds like a bit complicated process, right?
It is. We are creating life, isn't it? So it is indeed complicated. It's not simple. We are mimicking something that happens inside the body. We are making a baby in laboratory conditions, and we are transferring it back into the womb.
Yes. Miss Hapangama, that we have heard there are advances in reproductive health or reproductive medicine. So tell us, how does technology help improve IVF outcomes?
Right. So when we look at reproductive medicine, that's a branch of science that goes in par with technology, right? As we talked before, we are creating life outside human body. So one factor why these patients are not conceiving is that fertilization is not happening naturally. It does not occur naturally. So the egg and the sperm doesn't fuse, in simple terms, doesn't fuse naturally, properly. So an embryo doesn't get formed. So technology comes into play. As an embryologist, I do the fertilization. I pick up sperms, advanced microscopes. Has good sperms, like they are swimming well, but the quality is very poor. The shape of the head is not good. Inside the nuclear matter is not proper. Okay, so then they won't get any embryos. So what I do is I use this technology now. Since it's quite advanced, we have this higher lens magnification microscopes, where compared to a normal microscope, the sperm will be magnified 7,000 times more, so that I can see the sperm very clearly and select the best sperm. Right, so that helps in fertilization. And then sometimes you see that although the sperm head looks good, the DNA matter is not good. DNA is important to take the genes from this generation to the next, right? That's how the father passes the genes to their children. So we have something called PIXI, physiologically selecting sperms, to see whether the DNA is intact. So these are specific dishes. They are not normal dishes, so these are specific dishes. So that's somewhere the technology comes into play. And as I said before, the incubators. Incubators are the womb in an IVF lab, right? So at Asiri Fertility Center, we have the newest incubators where we have separated chambers in that. This allows us to give each patient a single chamber so that embryo development won't be disturbed. And of course, the air quality. We have specific filters in the laboratory, carbon filters and all this stuff. And then to make sure that the VOC particles, that is called volatile organic compounds, these are detrimental to embryo development. So all these technological aspects help us to increase the success rate of an IVF cycle.
I think we are hearing so many technical words. What is PGT? Please explain.
Of course, that's a good question. Actually, I should have mentioned about PGT before as well. So PGT, the term is pre-implantation genetic testing. That's where we, once we make the embryo, I do a biopsy on the embryo. That I do by giving a laser shot. Talking about technology, so it has the laser shot. So we are giving a laser shot to something that we cannot see with the naked eye, right? So I'm giving a laser shot and I will take out cells from the embryo and we send it for genetic analysis. So we at Asiri, we have a highly sophisticated, very precise laser systems to enable us to do this PGT. And of course, it's embryology skill to make sure the embryo doesn't die when you're doing biopsy on it. So we give a laser shot, we develop the embryo up to day 5, we call it a blastocyst. Then we give a laser shot, we take out those cells, and then we send it for next generation sequencing, which is again a genetic analysis. This is important for patients who have had abnormal babies before or multiple miscarriages. It's important for patients who have had previous failed IVF cycles. And it's a known fact that when a female ages, the age of the female has a direct effect on the embryo quality or the egg quality, right? So what happens when a female ages, when she goes up beyond 40, 39, 40 years of age, there's a high risk they could get Down syndrome babies. The problem in Sri Lanka is we cannot abort according to our law. So this PGT, where we check genetics of the embryo we created, enables us to find the healthy embryo, so that we check it, then we see that DNA wise, the embryos has whether they have Down syndromes or any other syndrome, and find the healthy embryos. So that is a PGT in a nutshell, I would say.
So Ms. Hapandama, please tell us, according to you, why should an infertile couple choose Asiri Health over other options?
Okay, Tashanti, if we take a success of an IVF cycle, depends on few factors. First is the expertise. To get good eggs, to get the womb lining properly, you need good subfertility specialists. So at Asiri Fertility Center, we have board certified subfertility specialists. And then the embryos are created by the embryologist. So the skill of the embryologist is very important because they're the ones who make your baby, right? So that is important. So at Asiri Fertility Center, out of the very few embryologists in Sri Lanka, the 2 embryologists at Asiri Fertility Center, they're both ASRM certified, that is American Society of Reproductive Medicine. And I think I'm the only one certified in the country, American certified in the country, to do embryo biopsy. So these are the expertise that affects, so that puts us, I would say that sets us apart from other fertility centers. Then the laboratory, the baby is created in the lab. The conditions of the laboratory is very important. And I explained before also how good the labs at Asiri are, that we stick to all the standards that's available in the world, So when you come to Asiri, whether you go to a Western country or Eastern country, we have the same technology here in Sri Lanka at Asiri Fertility Center. And then this is a very private matter, a very intimate matter, isn't it? You need a child, you don't want to talk about it with other patients or other people. You don't want your own in-laws to get to know. So at Asiri Fertility Center, my whole team, we take responsibility in maintaining that confidentiality. If you come to our center and see, it is kept different. Like I would say, it is kept away from the other departments, so that we protect your privacy and the confidentiality. And of course, we only do ethical practices. All of us, we follow ethical practices. And then it's transparent. We make sure every step of the process is transparent. If the eggs are not good, I would sit with the patient and explain this is what has happened. If the sperms are not good, the same way, So every step is transparent. And the other main thing is, this is something a lot of patients ask from me. They're so worried whether their eggs, whether it's their baby. Eggs and sperms are not labeled, right? So an embryologist should be of zero errors. So at Asiri Fertility Center, every step of the process is dual witness. That means 2 people witness, 3 identification factors. One person can make a mistake, but not 2 people, right? They can't make the same mistake. So every step, from the time we take the eggs out, once the baby is created, up to the point of transferring the baby back into the womb, every step is being witnessed. So we maintain this zero error. From the time we have started Asiri Fertility Center, I'm quite proud to say that we have not done any errors. So all these sets us apart from other fertility centers.
We hope Ms. Himashi Hapangama, the Chief Embryologist of Asiri Health, answered some of your main concerns. So thank you very much for joining us today and sharing with us your valuable knowledge and insights. Thank you.
Thank you, Tashanti, for this opportunity.
Some still have questions regarding infertility, fertility, the treatment options, success rates, and also emotional impact on the couples throughout the journey. So, to answer your questions and to help us understand better about this important issue, we have invited a distinguished medical practitioner in the country, Dr. Udara Jayawardena, fertility specialist. Welcome to the program, Doctor.
Thank you very much, Tashanti. Thanks.
So, Doctor, please explain what are the most common causes of infertility among couples today?
Okay, so as an intro, I would say, first of all, let me tell what infertility is. Infertility is when a couple tries for a baby for at least 1 year, and if they are still unable to get pregnant, then we say that couple may be having issues with fertility. So that's when we start to investigate a couple, usually. But if especially the woman is a little bit older, like for example, more than 35 years, we don't wait for 1 year for them. We may start investigating early. And similarly, if they have certain issues, like for example, previously identified medical issues or menstrual problems, then again we start treating and looking for causes immediately. About causes of infertility, first of all, sometimes we may not be able to find a cause in either of the partners, and that's what we call as unexplained infertility. And if we take about 100 couples who are having fertility issues, about 20-25%, we may not be able to find any cause. So they fall into the category of unexplained infertility. And looking for a cause, we have to look at both partners. When we are dealing with infertility, we take it as a couple's issue. We just don't try to single out a certain partner. So that the reason for that is about 50% of time we can find causes in women, and about 50% of the time we can find causes in men. So more or less, they have issues equally. Talking about the male partner, we are interested mostly on the sperms, the quality of the sperms and the number of the sperms. So we do a test called seminal fluid analysis, and in that we can get information about the number of sperms as well as how well they are moving. It's called motility, and also there's another component called morphology. So morphology is that how much of what percentage of sperms are in the normal shape. So we want the sperms to be at least 4% or more to call it in normal morphology. Right? In the female, we are mostly interested in the egg reserve, as well as the tubal factors, the uterine factors, and also whether she has other medical issues. Apart from that, we are also looking into the sexual disorders as well, because a lot of our patients also have sexual issues. You won't believe that a significant proportion of these couples also coming with erectile disorders as well as vaginismus, so they're unable to have a proper penetrative sexual intercourse. So basically those are the causes, and these are the areas we look into when an infertile couple comes to us.
Yeah, doctor, tell us, when should a couple seek treatment? I think you have already mentioned the timeline.
Yeah, so if they have an issue, they have to come to a doctor straight away. For example, if they have a problem in sexual activity, like they have sexual dysfunction, for example, in the man, if the erection is not properly happening, or if in the woman there is vaginismus, so they can't have proper sex, then you have to go to a doctor to find a solution for that. Apart from that, if there is a pre-identified medical disorder, or in the woman, if there are menstrual irregularities, then of course you should not wait. It's always better to go to a doctor and see what the problem is. But if there is no such problem identified, then they can try for at least 1 year, provided their age is less than 35 years, right? So you try for 1 year, and there is about 80% chance of having a natural conception. That's why we want them to have a proper sex, unprotected sex, at least for 1 year. So if somebody comes to us, we are not going to intervene straight away. We are going to give them some time, so there is a good chance that they can get pregnant naturally. At the same time, as I said before, if the female partner, especially the female partner, is more than 35, we would not wait 1 year. We would start intervening around after about 6 months. The reason for that is the egg reserve declines after 35 years. So your fertility potential also declines with that. So we don't want to wait for too long. Okay? So as I said before, you can try for 1 year. If you are more than 35 or 36 years, maybe you can try for 6 months. But if you have any issue, any problem, you should meet a doctor straight away. Okay?
Doctor, what are the investigations you usually recommend for these couples?
Again, male partner, we look at the spermatozoa. So we ask them to produce a semen sample, preferably in the hospital where they do the test, and then we look at the sperms. Sometimes our couples are asking whether they can produce a sample at home and bring. Important thing is if you're doing that, you have to bring it as soon as possible. We would advise them to bring it at least within 30 minutes time, because if you wait too long, then the quality of the spermatozoa may change, and so we can't properly interpret it. When investigating a female partner, we are looking at the ovarian factor, tubal factor, uterine factor, and other medical disorders. So if you have a look at the female reproductive system, there is a womb. In scientific terms, we call it uterus. And on either side of the womb, there is a tube, and it's called the fallopian tube. And also on either side, there is a structure called ovary. So ovary is the organ that contains the eggs or oocytes within them, right? So what happens is that these ovaries, they have a lot of eggs, and in every menstrual cycle, a certain number of eggs start to grow. And out of the ones that have started to grow, one will reach the mature state and it will release. So this is the process that's called ovulation, and this released egg can go through the tube, and that's the time they are able to fertilize with the sperm if they have had sexual intercourse. So once it has fertilized, it will slowly come into the uterine cavity and gets implanted. So that's what happens in a natural conception. So we have to look at the ovaries to see whether the egg reserve is good, and we also want to find out whether the ovulation is happening properly. So usually in a younger woman, we expect the egg reserve to be in the normal level, but there are certain tests we can do. One is a blood test called anti-Mullerian hormone, and the other one is a ultrasound scan. So in the scan, we are looking at the ovary and counting how many small follicles we can see. So by using that number, we can interpret whether the egg reserve is good or whether it is below average, right? At the same time, ovulation, if a woman is having menstrual cycles every month, so they are more likely to have ovulation, right? But there are certain tests like serum progesterone, which is done on day 21. It's a test that we use to confirm whether the ovulation has happened. Similarly, we look at the womb. So what we do is a scan. Preferred scan is a scan that is done vaginally. It's called TVS. And in that, we look at the structure of the womb, whether it is in the normal size and the shape, whether the cavity is normal, or whether there are any pathologies like fibroids or polyps. So the other thing is the tubes I mentioned earlier, which is on either side of the uterus. So we need to see whether these tubes are patent. So the tests that we do, there are two tests we can do actually. One is called HSG. What we do is we inject a dye and then take an X-ray. So we can see the dye in the X-ray. So if the tubes are patent, then we can see that it has gone through the tube and has come out and spilled inside the abdominal cavity. So that is called HSG. It's a very simple outpatient procedure. The other one is a surgery. It's called laparoscopy. In that we use a camera that is inserted into your tummy, and it will be done under anesthesia. So the best test is the laparoscopy, but HSG is easy to do. And if the HSG is normal, then there's no need to go for a laparoscopy unless there is some other indication to go for surgery. So those are the investigations that we basically do. We also look into other medical issues like whether there are any thyroid abnormalities, whether the prolactin level is high, whether she has any impaired glucose tolerance or diabetes, because all these could have an effect on the fertility chances.
Doctor, we have heard there are a few treatment options. So how do you decide whether a patient needs an IVF or IUI or other treatment?
Okay. So yeah, as you said, there are few treatment options. Basically, I would say you can try some medication and try it naturally. You can try some medication and try a procedure called IUI or intrauterine insemination. And the last option is IVF or in vitro fertilization. So out of these, IVF is the most complex and the most advanced fertility treatment type we have anywhere in the world. But usually when we are dealing with a subfertile couple, we start with something simple and then move on from one treatment option to a more complex one. So we usually start with the simplest, which is ovulation induction and timed intercourse. So we give some medication to the patients, and then which will support the growth of the egg or the follicle. And then we ask them to have sexual intercourse during the time that we expect the ovulation to happen. So that is called timed intercourse. The second one is IUI. What we do is similar to the timed intercourse, we may give some medication to support the follicular growth. And then we do a procedure where we take some sperms from the male partner, we process it and make a small sample, which is high in sperm number as well as motility, and then we transfer it into the woman's womb using a small catheter. So that's called IUI. And that is the next step, and the last step is the IVF. But depending on the problem the couple has, sometimes the doctor may recommend IVF straight away, or they might say you can start with IUI or they might even say you can start from the timed intercourse and go to IUI, and if they are not successful, they can try IVF at the end. So, as I said before, what we have done in the investigation is very important to decide on what type of treatment they will need, right? So, the treatment will be offered depending on the problem that identified. So, if the couple is having no identified fertility issue, like for example, if they're having unexplained infertility, or if they're having mild fertility issues, we generally start with the simplest method, which is we can either ask them to have sexual intercourse naturally for some time, or start with some medication and ask them to have timed intercourse. If there are difficulties in having sexual intercourse, or if there are sperm problems, then we might decide to go for IUI straight away, because in IUI we are able to get a better success rate in such patients. The last option, for example, if the sperm count is very low, or if there are no sperms, and if the egg reserve is very low, or if both tubes are blocked, then in those cases we may tell you have to go for IVF straight away.
Doctor, you explained that IVF is the most complex process or the complex treatment. So, tell us what are the factors that affect the success rate of IVF?
What we do in IVF is that we make an embryo in a laboratory setup using a sperm from the man and an egg from the woman, right? So the fertilization takes place outside the body in a laboratory. So in a natural conception, as I explained before, the fertilization happens in the fallopian tube, right? But here we do it outside, and then we transfer this embryo into the woman's womb, right? So the quality of the embryo is very important for the successful outcome of IVF, and also the quality of the inner lining of the womb and the quality of the womb itself is important for the success. So we also have to look at the medical issues of the woman. Generally what we do is we do optimization prior to IVF cycle as well as prior to embryo transfer. If there are any issues like diabetes or any hormonal abnormalities like thyroid issues and all that, we would correct all them before going ahead with the embryo transfer. Because when you get pregnant, it's going to be a 9-month project. So it's always better to control things at the very beginning before stepping into motherhood. And another important thing that I want to mention is that some of our women are in the overweight category or in the obese category, and generally they may face more complications than a woman who's in an optimal weight category. So we would recommend and advise them to lose and bring them to the optimal range prior to IVF and embryo transfer as well. Because when you get pregnant with a very high BMI, then the miscarriage rates also go up, and also they may face medical complications like diabetes, gestational diabetes, and hypertension as well. So those are the things that we look into. The other important thing is that, as I said before, the making of the embryo happens in a laboratory. So the condition of the laboratory and the team is going to play a very important role in making sure the embryos are of good quality. Because in an IVF lab, things have to be maintained at very the standard levels. The temperature, the oxygen levels, carbon dioxide, all these should be maintained at optimal levels. So if they are not maintained in optimal levels, then the outcome could differ. And also the experience of the staff, experience of the embryologist, storage facilities, everything comes into action. So it's always important to choose a good IVF laboratory if you have any plans to try IVF anytime in the future.
Thank you very much, Dr. Jayawardena, Dr. Udara Jayawardena, fertility specialist, for sharing your valuable knowledge and insights with us today.
Thank you very much, Tanish.